Hi, so this is part 2 of the surgery. This is the before, the after, the whole recuperation, because the other video was getting very long. So this one is the whole entire after process. So like I said, I got surgery the February 14th and it's the 3rd of March, so that's like the timeline of how long I've been in recuperation. It's a 2-month recuperation. They give you 15 days of no work, and then it's 2 months. My surgeon basically said, just keep acting like you're still have surgery, you know, don't do anything, you can't do physical activities, you can't walk repeatedly steps up and down. I don't know why that's a thing, or people were doing that, but that's like one of the things that they specified is don't do that. So let's start. I get back from my surgery, and obviously I'm still a little like, even though it's been 6 hours, I'm still a little like, woo. So I get home, I take the steps, because I have steps going up from my garage to the first floor, and then steps from the first floor to like the second floor, and so I take every step like one by one, and they tell me, my parents told me, just take the steps backwards so it doesn't have, you know, it's not that much impact on your abdomen. So I start taking steps one by one. I get, you know, my first meal is just a bunch of potatoes. They just mashed up a bunch of potatoes, and it was just me eating a bowl of potatoes, mashed potatoes, just. And then I went upstairs, and in this bed, because this bed has this, my bedroom doesn't have, you know, air conditioning. This one does, and so I was like, I'm gonna stay in this bed. And so basically my diet was tea. Oh, also, tip if you're getting this surgery, there is a thé anise. I'll put the English word here because I don't know what it is, but the nurse told me that it's good at expulsing the gases, because you do need to walk intervals of 15 minutes so that the gas can come out and it won't stay inside you. So yeah, you have to kind of, I would put alarms so I could just walk 15 minutes, and then after the alarm I would go back and lay down. Literally let yourself rest. Don't just go at it, like, no, just let yourself rest. Take it day by day. You obviously, you do get nervous because you don't want to tear anything, you don't want to pull anything, but I would recommend to always try to sit up straight, because you don't want to like recuperate all, like, you just want your skin to be flexible. You don't want it to be like all tense. It's easier said than done, obviously, because the first days you are in pain. And there was 3 medications that I had to take. One was antibiotics, the other one was, and like, it's so it doesn't like expand, doesn't like, it's so it doesn't like hinchazón. I'll put the word basically, so it doesn't like bloat, or, and then the third was the pain medication. And there was the pain medication and the antibiotics were for 7 days. They were every 6 hours. The other one, that was every 8 hours, and that was only for 4 days. The first days are kind of rough, apart from the fact that you are in pain. Taking medication every 6 or 8 hours and having to have your stomach full of food, because, you know, you can't have that medication without any food in your stomach, because it will kick your stomach. And so I was eating at like 11, I was eating fruit, and then I would wake up at 6. I tried to accommodate it, so I would have to at 6, and then 12, and then 2, and then 6, and then 8, and then 12, something like that. It was very continuous, so it does feel very like just jarring. And so I had to tell myself, it's just a couple days, it will pass quick, and it does. And for me, the 3rd, 4th day, it didn't hurt anymore. Getting out of bed, I did not know how to get out of bed. I just laid there, like laying down was painful, and I would just lay there. But then having to get up, I was like, how do I get up without using my stomach? Like, how do I? And it's painful, but it's a thing you just have to do. And you just have to use more like your arm strength, and just kind of roll, and then just kind of push. Like I said, easier said than done. Like, there were times where I was just laying there thinking of, how do I stand up? Like, how do I sit down? But yeah, I ate a lot of soup, Jello, crackers. That was it, basically. Now I still kind of eat the same thing, but I also eat pasta, chicken, avocado, but I can't eat any dairy and I can't have any grease for 2 months. So, but anyways, the vein exploding. That was super painful. Literally, up until yesterday, it still hurt. Like now, it doesn't hurt at all. But yesterday was still hurting. It lasted so long. Like I said, I will post pictures that I did take, but it was blue. Like it was blue, and I was like, so obviously on top of that, and I did not take a shower every day because obviously I have wounds on my stomach. It's not easy. I just stayed in bed, and like I said, I would stand up, do the 15-minute walks during the, like, I would probably walk like 4 or 5 times in a day, and I usually just would lay down, sit, you know, I let my body take it slow. And then when I would take a shower, my mom would help me. She would put like a plastic bag over it with tape to make sure it didn't get wet, because I didn't want them to fall off. The surgeon was like, if they fall off, they just fall off, but I didn't want to see that. I didn't want to see them, so I was like, I don't So thankfully mine were still there until the appointment to get my stitches out. Oh, that was another thing that was. So let's talk about stitches. So another update, I got my stitches out today. Oh boy, the belly button one was way more painful than the other two. The one on my, like, near my chest, didn't feel it at all. Like, it felt a little pressure, but it wasn't bad. The one on my side did hurt, but the belly button one, oh my god. So, by the way, I had long nails. I cut them because she said to, you know, because your belly button, since it's like, you know, there's a dip, she can't put, like, micropor. I have no idea what that's called in English. I'll put the photo here. She put it on my other 2 ones, and she said I can't put it on there, so just, like, don't touch it, don't, like, scratch it. So just in case, you know, even if I'm asleep, because you don't know when you're asleep, you might accidentally, like, scratch or something, so I cut my nails. But, yeah, the one on my belly button was painful, because she's like, I need to pull it from, like, completely out, and there was, like, 3, I think I felt like 3, but yeah, I got in trouble. She was like, I'll talk about that later because it's still kind of like, That's kind of the update for now. It's the 26th, and I still have it bruised, like, wild. So yeah, that's my mini update with my stitches situation. So yeah, talk about stitches. So that, I was very nervous for that, because for my other surgery, my stitches were like staples, and they didn't hurt. There was a little bit of pressure, but it didn't hurt. But this one, they weren't staples, so I was like, okay. So I could sit down. I still don't wear, like, jeans or anything. I wear leggings, and I wear these, like, jeggings, and I'm wearing dresses. Other than that, I'm not wearing anything near my stomach. Nothing. So I get there, and the nurse is one of those that instill the fear of God in you, because she just assumes that everyone isn't going to pay attention. Me, I follow every indication from the doctor to a T. They tell me every 6 hours. They tell me to go do 15-minute walks. I do the 15-minute walks. They tell me not to squat. I won't squat. But obviously some people don't follow instructions. I remember the surgeon, the day that we were leaving the hospital, he was like, do not put anything on your wound because your grandma used to put Jello, so you're gonna put Jello. Do not put anything on your wound. Those doctors probably have to put up with so much things, people putting weird things anywhere because it's like natural medicine. And no, leave the wound alone. Anyways, so she calls me. She does not let my mom go in, and my mom's like, and I'm like, because usually my mom listens as well, but whatever. So she's telling me all this information, and she's like, did you have your appointment yet? And I'm like, no, I haven't like ordered my appointment with my surgeon, so it's like a post-op appointment. And I'm like, no, I don't have that yet. And she's like, well, if you bleed out or if you get something, then it will be on record that you didn't get you didn't get an appointment. And I'm there like, okay, why? So that happened on a Wednesday. I ended up getting my appointment on a Friday, literally that week. But anyways, and so she takes off the micropor, which is, oh, I think I have, I don't know where it is, but it's like medical tape. So she takes it off. She takes the belly button one off. Obviously, I have hair on my belly because I have PCOS. If you didn't know, obviously you can tell my arms. So that was painful. And she was like, yeah, it's gonna hurt because you have hair. And I'm like, yeah, I know. I can see. I can tell. And so when I tell you, it hurt. It hurt. The belly button one. The one on my, like, the lower my chest, I didn't even feel that. I didn't feel anything. The one on my side, I did feel the pressure, like it hurt. The belly button one, she was like, I have to pull it from the stem so it doesn't stay anything inside. I don't know what I don't even know what she meant by that, but it was painful. Like, I felt that all the way inside, and I tried to like take deep breaths and keep my stomach relaxed. It was painful. And then she cleaned it with alcohol. That didn't hurt, thankfully. I was kind of worried that it would. And she was like, okay, so you're gonna clean it like with alcohol. You're gonna put alcohol on your belly button. She put medical tape. I still have that medical tape. I'll tell you why in a second. And she's like, what you're gonna do, I'm not gonna put any medical tape on your belly button because it's concave. So she's like, just fill it up with alcohol, and you're gonna get gasa, which is picture here, and you're just gonna put a little bit and then just turn it, and that's it. And you're gonna do that until Saturday, and it's gonna, you know, it's gonna get like scabs. Do not pick at it. And I was like, okay. And then she's like, for this medical tape on here that I'm gonna put on, when you're gonna pull it out, you're gonna pull from the top, from the bottom, and then you're gonna have like a little butterfly, and you're gonna yank it up. You do not yank it down, do not yank it up, because then it will open your wound and you will bleed out. And I was there like, got it. And she's like, order your appointment, goodbye. And I was like, yes, goodbye. So I get my appointment on Friday, literally 2 days after, and I'm like, and he checks it out, and he's like, it's good. Like I said, no physical exercise, keep your same diet for 2 months. The thing is, on the medical order, like the thing that they, like the medical things that they gave you the day of the surgery, it just said that I couldn't eat milk, like lactose, I couldn't eat lactose for 20 days, but then the surgeon said 2 months. So I'm like, but I've been going with I'm going with the 2 months, because like, I'm not messing with that. Anyways, so sorry, my brain just went like, but because I'm not messing with that. So 2 months. Anyways, and so he checks everything out, and he's like, you're good. Just, you know, keep acting like you still have, you know, you still operated. Don't go crazy. Don't, you know, keep it chill. 2 months. And I'm like, cool. So then I ask, and he's like, oh, you can leave. And then I ask him about this, you know, and he's like, oh, just let it fall off by itself. And I'm like, thank God. Because I told him, the other nurse told me that it was gonna bleed out, and he's like, no, just let it fall by himself. Just let it fall off. Like, it's fine. And so I'm letting it fall off. Right now, obviously, I'm taking showers every day because it's fine now, because I don't have stitches, and I'm letting it fall off so I don't put any protective, like, plastic on it. But that nurse freaked me out. I was like, oh my God. And so obviously I was very careful the first few days. So I was like, I don't want to move. I would sleep always on my back. Now I can sleep on my side. It doesn't hurt. I like move this way, move that way. It's fine. Obviously I still don't wear pants because I'm like a little bit worried about that. When I'm walking out in public, I try to not go to public that much because, you know, a lot of people, you just, you know, but I usually walk when I see people very close. I kind of put my hands in front of me because you never know. You don't want people smacking you in your wounds, even if they're healed. No. Because I just had an experience. Obviously the difference is this one, they stitched me up. The other experience, they did not stitch me up. So obviously the wound just broke up. We're not going there. No. Anyways, so stitches done. Cool. Told that I was, you know, good, and that I just had to keep, you know, taking care of myself. And I was told that to clean it, I just had to clean it until Saturday, last Saturday, and that's it. I know you're probably like, wow, that's it. That's it. What can I tell you? That's it. I know, it's amazing. Obviously I haven't even, you know, celebrated the first I probably should sit here in case people are like, actually, does she actually have a shirt on? I do. I haven't even celebrated my first month of surgery. That will happen in like 11 days. So, but yeah, it's pretty much just very chill. Do not put your body in stress, and but also don't act like static. You know, you have to make your body move to make sure the wound also moves with it, and so it heals. And because I remember someone told my mom like, oh, tell her to walk, because someone else did not walk. They just laid in bed, and so their wound just stayed like this. So now their body is just like, that part is just like this. And I was like, why don't you follow the doctor's orders? It literally says to walk. So yeah. that's the thing. That's everything. And I'm not taking any medication, and I still sleep on my back. I can sleep on my side, but I preferably want to sleep on my back still, because like I said, I don't want to, I'm very aware of it, but I don't want to do anything that will be like, oops, like it just moved, it just hurt for a second. I was like, what the heck? But yeah, I'm aware of it, but I'm also not hyper aware of it, if that makes sense. Like, you just can't forget about it. And like, I remember one time my mom was gonna tickle my stomach, and then she was like, oh my god, I forgot you had surgery. Because obviously I'm walking around, I'm doing things, I look fine, I actually feel better. And so people forget that I'm operated. And I don't look like it, I guess. And I've had moments where I do still like burp how I used to, but I think it's just my body getting used to things again. But my surgeon was like, you can eat meat again, you can, you know, just do not eat anything greasy, do not eat anything with lactose in it, but you know, you can start eating meat and rice, because I haven't eaten meat since July. It's been a while. And so I'm taking everything slow and taking it day by day and letting my body just kind of go with the flow. I don't want to rush it, and I don't want to like make things more, you know, complicated. I don't want to, you know, just everything in its time. So yeah, that is the after. And the after was so much better than, you know, of course there were days where I would stand up and it was painful. You know, my wounds, like my belly would hurt. And the thing is, sometimes it wasn't even the wounds, like the external wounds, it was on the inside. Because obviously they cut an organ out, so they have to like, I don't know if they have to burn it on the inside, but it's gonna hurt. And so it would hurt where there wasn't any external wound. It would just hurt where my gallbladder was. So it would hurt when I would stand up. It would hurt when I would walk. And obviously right here I still had that pain, and it was pretty painful. And I was taking medication, and it was painful on the inside but not on the outside. And like, yeah, there were moments where everything was kind of like stiff, and I'd be like, what the heck? But yeah, you just have to take it day by day, and it's not as long and it's not as dreadful as you see it. You have to remind yourself of that, because there were moments where I was like, oh my god, it's just, this is my day to day, you know. I feel like I'm getting so overwhelmed because I'm taking like, how many pills were I taking? 1, 2, 3, 4, 5, 6, 7, 8, like 10 pills in a day, probably. Something around that, or 12. And so you do get overwhelmed, because you're like, okay, every like 6 hours I'm eating, every 6 hours I'm taking pills, and like I have to get up, and it's a lot. It's a lot. So like I said, just try to be very calm about it. Do not work yourself up. And don't be afraid to look at your wounds. I mean, even if you have like the medical tape, look at it and be like, also, I cut my nails because she told me after I got my stitches out, she's like, do not scratch your belly button, because you have a lot of, you know, just even if you wash your hands, you still have stuff on under your nails, and that can create infections. So I was like, okay, maybe what if I'm asleep and you don't really know and you just unconsciously scratch it? So I cut my nails for that. Recommended, because you don't know what you do when you're asleep. You might just accidentally go like this. You don't know. Even though I do wear long like shirts, you still never know. But yeah, I was very productive this time. I did a lot of necklaces. I let myself nap. And the thing is, after the surgery, like maybe maybe like 10 days after, I went out and I was very tired. Like, I got home and I just slept, and it's fine because obviously your body's adjusting, and also the anesthesia in your body lasts a while, so your body's kind of getting used to it. And I went to another appointment to get a medication, just a normal medication that I need, and the doctor or nurse, I don't know, she offered, because she had a vaccine for HPV, I think it's called. Again, I'll put the name. And she was like, okay, I have one, it's free, let's do it. But then my mom was like, wait, she just had surgery. And she was like, when? 14th? Like, yeah, no, you have to wait a month for the anesthesia to leave your body for you to get like vaccines or something. So yeah, just let your body recuperate in peace. Don't try to like speed the process. Don't be like, I can do this, I can do that. Just chill. Like, even when I'm going in the car, I will like stretch out a little bit the seatbelt where my belly is, so if like my dad has to like, you know, stop abruptly, it's not gonna be like, you know, just think of little things of that. And yeah, so this is this video. I know it's pretty short compared to the other one, but yeah, I'm still in the process of recuperating, but it's been really good. Obviously the first couple days are very hard, and you will see in little clips in the, I don't know if I'm gonna put the clips in the other video or in this one or both of them, what do I know? But yeah, also thankfully my veins are not. Hi, yeah, I know the video just abruptly ends, but it was basically just talking about how my veins got better. But I'm now like very much, uh, you know, we're in June, so it's been a while since this video, and I was thinking of doing an update about my health and my food and all that stuff. But yeah, this is basically it. This was, you know, it's not that scary. If you're thinking about doing the surgery, I would highly recommend it. For me, my quality of life improved drastically. So yeah, if, like I said, if you're gonna get the surgery, good luck, and I hope everything works out for you.